a simple way that we can also use as a clinical reasoning for our patients is 3 or 4 different ways that you can actually differentiate between the pain is coming from your shoulder or is coming from your neck. First, the pain, if the type of the pain itself is a kind of a numbness or a tingling type of pain, this should always come from your neck. Your shoulder will not create any numbness or tingling type of pain. But the pain, it could be dull aching pain or some different type of pain that could be actually coming from your shoulder. Now, the history of the condition itself, if that patient is a person who used like his hands and his arms always up trying to do some construction work, painting or something like this, they always stress the shoulder structures, and that could be a good reason for why the pain is coming from your shoulder and it's not coming from your neck. On the other side, if it's a person who sit and spend a lot of time on a computer looking down or using their neck or head a lot of time or driving for a long period of time, then they're stressing their neck, and that could be a reason why the pain is coming down to your arm. So the second reason is we look back at the history of the patient and see if that pain or if that person is what kind of work they do or what kind of a lifestyle that they have. Also the pain, if the pain is coming from your neck down here, it's always the pain in that area will be coming from your neck. Your shoulder will not create any pain to go up. It's actually going to always go down to the arm if it's happening. Sometimes it might not even happen to refer pain down the arm. But the pain in the shoulder will not go up to your neck. But on the other side, the pain in the neck would always come down to your neck area if it happens. So that's the third reason for you to differentiate between the pain, if it's coming from your neck or it's coming from your shoulder. Now, when we have the person, or if you're watching me on that video, it's a simple way that you can actually create some movements through your neck between bending your neck side to side or rotating your neck from one side to another, looking up and down. And if any of these movements create a change in your symptoms down your arm, then it's probably coming from your neck. Also on the other side, for your shoulder, if you're sitting watching me and you start to raise your arm up and down, moving your shoulder behind your back, or even do some rotation for your shoulder, and the pain symptoms kind of change down your arm, then that pain is coming from your shoulder and it's not coming from your neck. So these are the simple ways to differentiate between the pain coming from your neck or from your shoulder. Keep watching our next videos. We're going to show you some other tests and some other techniques that you can figure it out, and we're also going to show you some exercise that can help with either your neck pain or your shoulder pain.